a little more about the healthcare debate that we saw in these Democratic debates over the past week, and particularly about Kamala Harris's health plan. Now, Kamala Harris had rather famously announced that under her plan, which she had not yet published, she would ban private insurance companies, and she got a lot of heat for it because then the next day she said she wouldn't. Happened again. She was asked, there was a ask for a show of hands who would get rid of private health insurance. Now, to be fair to Kamala Harris, that question was badly phrased, as many things were badly handled by the moderators in that first debate. And she raised her hand and then clarified that she would not ban private insurers. So I guess she was under a little pressure to come out with a more detailed plan. She did so last week. I wrote about it in Common Dreams and elsewhere. The piece was called "The Fatal Flaw in Kamala Harris's Health Plan." And, the bottom line is this. Look, first of all, I'm thrilled at the way the political debate has shifted on healthcare over the last 4 years. When we were working on Bernie's first campaign and talking about Medicare for all, nobody was for it. The year before he ran for the Senate, when Bernie introduced a Medicare for All bill in the Senate, he got no co-sponsors. When he introduced it after the campaign, he got 17 Democratic Party co-sponsors in the Senate, a huge chunk of the Democratic caucus there. Now, when the Affordable Care Act was being debated in 2010, the leftmost flank of the Democratic Party by far was to have a plan with a public option where people could buy into Medicare. That was the crazy left position that Obama said he supported, but then at best did nothing to make a reality. Now we find that's the far right position in the Democratic Party. That's Joe Biden's position in one form, and Kamala Harris's position in a slightly different form. So first of all, thank you, Bernie, and thank you to everyone else who successfully moved this debate so that that is now where the Overton window of political dialogue rests within the Democratic Party. That's fantastic news. So in that sense, first of all, Kamala Harris's plan is substantially better than Joe Biden's because it would move everybody into a Medicare-like system over a period of 10 years. Why 10 years? I think it's political expediency, like a lot about this plan. But let's talk about what's good about it, okay? It would move everybody into a Medicare-like plan. That's good. It would take it out of the hands of the employers. We keep hearing that supposedly that makes people nervous. I don't think anybody would be nervous to know they're guaranteed a better plan than that which their employer gives them, particularly since those plans tie people to employers they may not want to work for. They prevent entrepreneurship. They can be changed by the employer at any time. And we've, in fact, seen a dramatic shift upward in what people are paying out of pocket in their employer health plans. So I think all that's good. The only problem is this: it keeps the private health insurance industry in the game. And I used to work in the private health insurance industry. There are experts in that industry and how to undermine through aggressive, what I call offensive underwriting, how to get the healthy people out of the public plan and make it suffer economically through something that's called adverse selection. But most of all, what the health industry has is lobbyists, and plenty of them. And those lobbyists, as long as the private healthcare industry continues to exist in its present form, those lobbyists will ruin any public plan. And believe me, over a 10-year period, they would definitely ruin Kamala Harris's plan. So as I wrote in my piece, that plan is too fragile, too complex, and most of all, too trusting of the predatory private sector to succeed.